The issue with these patients is the surface, and therefore the context seemed to me the right one, but actually these are patients who suffer from a very rare recessive autosomal disease. It is a hepatic deficit of the dehydrogenases of the IHGD activity. So we have an accumulation of homogentisic acid in the blood, and there is an accumulation in the urinary tract and all other tissues. And this has already been reported by Virchow's and of 19th century, and the patient comes to an ophthalmologist, first of all, due to the deposit of pigment at the scleroconjunctival level. So the reason why this acid gets deposited into the connective tissue is still under investigation. So the referral center for Italy is Siena in Tuscany, where there is the headquarters of the alkaptonuria patients and experts, and I have been the referral doctor for the assessment of the cases that have been so far been collected. The way in which this assessment was by means of a traditional visit plus the necessary signs, symptoms taking examination. And the pigment is deposited lately at the scleroconjunctival level and in the joints, causing heart valvular diseases. And the patient often is observed and seen by non-eye specialist, and this causes a bit of confusion very often. The reason why the pigment gets accumulated is unclear still. But the program that we are carrying on in association with the referral centers for the study of captonuria in Europe is quite complex, a continuous follow-up and analysis. But what I wish to tell you is that actually the possibility to diagnose captain AKU is quite simple. No special device is necessary. A torchlight is enough, and the anterior segment of the eye must be observed, and that's what you can do very well. No special knowledge is necessary. In our case series, we have found the pigment described in the literature in 78% of cases, episcleral. We had no case of pigmented glaucoma, and we didn't find any thrombus or thromboembolism, and this is one of the features, of the typical features, and we have at this point developed a protocol for these patients where a continuous monitoring is carried out by means of specialistic visits and our contribution as ophthalmologists. Very often these eyes suffer from cataract as well. I have put several of them to surgery. Once children, if children, they come to you, and the mother typically says that the urine is dark in color, and this might be, indicative and easily memorized. And then there are these black spots that that between 30 and 40 years of age. These are pictures that I have taken with a smartphone, and nothing special. All you have to do is to teach the family doctor or the pediatrician that with a bit of attention you can notice these dark spots that are pathognomonic and may be indicative for ophthalmologists. And issue is when these spots aren't that significant or relevant, so that even for ophthalmologists, a differential diagnosis is necessary. Since you specialize in the anterior segment of the ocular surface, when you have to do with people presenting with these bilateral spots at the sclera or the conjunctiva, that it could be you might go for the homogentic acid in the blood, or you might send us a sample and we'll take care of the testing. So, or oil drops. These are oil drops as reported in the literature. Let me also show you patients. I have a certain delay when in moving on with the slides. Okay. If you were to observe these small spots on the limbus, you should immediately be suspicious or suspect this pathology, the pathology of the surface of the eye that might camouflage or mask captanuria. The result is, however, can be easily understood and especially when it comes to the most relevant of the pathologies implied, that is the conjunctival melanoma, which is the most severe case, which never has a laterality. This is because when you ask a doctor if he or she has or sees spots in the eye, a non-ophthalmologist might confuse any spot for this specific symptom, but actually it is only for a specialist to perform, to make the differential diagnosis between a conjunctival or a conjunctival nevus, melanoma or nevus, and the AQU. Sorry. There are also acquired forms of this disease. From a histological viewpoint, I will skip it and I will go directly it was just to show you. Okay, doesn't matter. I'm sorry, but it got stuck. Slides got stuck. So it takes a very long time to move from one slide to the following one. Okay, thank you so much. It's